More evidence this morning of waste, fraud, and abuse inside Medicaid. A new investigation from OpenTheBooks.com found Massachusetts Medicaid paid for thousands of non-emergency medical rides that never happened, including some billed for patients who were already dead. Joining us now to discuss is Deputy Public Policy Editor for OpenTheBooks.com, Rachel O'Brien. Good morning to you, Rachel. So your report found that Massachusetts Medicaid was paying for thousands of these ghost rides that never happened. How big was this fraud scheme?
So in the largest case we saw, there were almost 17,000 trips in these non-emergency ambulettes that never happened. So a gentleman named Bakali Mukasa, who's a Ugandan resident, he had a company called JBM Health that was based in Waltham, Massachusetts, and he collected more than $770,000 from Massachusetts Medicaid for these rides. They never drove them between July 2019, November 2020. So he was indicted. The Massachusetts Attorney General indicted him. That was earlier, right, this year. Then last year, the same office indicted another person, and his Worcester-based instant transportation company, it was called. Again, same thing, Medicaid fraud. They lied about rides. They got more than $3 million for rides between August 2018 and August 2023. Went on a very long time before they were detected. So between those two schemes alone, $3.8 million. And there are many more like that. We found another $380,000 scheme, another $1 million scheme, all in Massachusetts for these rides that never happened.
So basically these two cases alone account for millions of dollars in fraud. And this is just the tip of the iceberg, right? What do we know about all the other figures?
Yeah, so we know that these types of rides, these non-emergency transport claims, they grew over 400% in Massachusetts. It started with about 4,400 claims in 2018, and it rose to 22,000, over 22,000 in 2023. So that growth alone is not proof of fraud. But we know, Medicaid enrollment in Massachusetts expanded significantly during the pandemic. And demand for this service is real, but the numbers also document that this program has scaled dramatically. You have these undetected fraudulent operations. So it is likely that as there's an increase in claims, there's also a corresponding increase in fraudulent claims that we don't know about yet.
What's most striking here is that taxpayers still do not have a clear way to track where all of this money is going. Why is it so difficult to follow the money inside Medicaid?
Yeah, for the Centers for Medicare and Medicaid Services, they don't show the dollar costs, just the claim numbers. The only reason we know dollar costs is because these are cases that were prosecuted, right? So in the Massachusetts state checkbook, their transport payments that go to companies, those appear in large sums and lump sums. So taxpayers can't see, or an outside auditors can't trace how much money each provider got. So there's no dollar cost there. There's another gap where the CMS suppresses data for providers that submit fewer than 11 claims per period, right? They say it's to protect patient privacy, but get this, the two companies that we talked about that the Attorney General went after, JBM Health and Instant Transportation, they don't appear in the CMS data because they're too, quote unquote, they're too small. They filed they are under that threshold of submitting fewer than 11 claims per period. So the public has no record, the public record rather has no way to flag them. The data is inconsistent and it's not transparent. You have this lack of basic control and opacity. It just makes it hard to find it until prosecutors go after these people. So Massachusetts has one of the most generous Medicaid programs in the country, and that generosity deserves transparency to back it up so we can make sure they're not stealing our money.
For good reason, because of all these fraudulent claims that we're seeing right now. This is wild. There's no way to track it. All right. Deputy Public Policy Editor for OpenTheBooks.com, Rachel O'Brien, thank you for joining us this morning. Have a great weekend.
You too, Jan.